The true luminaries will be working tirelessly for the cause of women's health. And it's an honor to be here today with you all. And I can see a lot of your community midwives who are training midwives. And it's a pleasure that मैं उर्दू में भी आपसे कहूँगी कि आपकी बहुत बहुत मेहरबानी कि आप लोग यहाँ ट्रेन करने आनी है और इंशाल्लाह ये ट्रेनिंग आप वापस अपने गांव में ले जाएंगी और वहाँ जाके औरत की खिदमत करेंगी एक औरत की खिदमत It goes back in Urdu and I'll address the rest of our foreign delegates who have come from Bangladesh and from Nepal, and obviously we're missing Afghanistan here today, but I'm sure they'll be joining this trainings and services in the near future. So with that, I would say that what is essential is not only dedication but also a will to work with women on such an issue because it's not a very clean area to work in. You know, surgeons like very clean surfaces where aseptic conditions are there, where you have sterilized services. Now, this is a fistula which is draining fecus, which is draining urine, and that is where you have to start working with these women. And obviously, a site where infections can reoccur, is a very difficult surgery to perform, and it takes a lot of effort and it takes a lot of post surgical care to help these women. And I'm sure prevention obviously is the way to go. We don't want our women suffering from fistulas, and the only way we can prevent it is by having good obstetric care and good antenatal care. Obstetric care in which we are not opting for C-sections all the time. The iatrogenic fistulas that are occurring because of hysterectomies or because of C-sections, those are the ones that we really want to avoid. But at the same time, when there is an obstructive labor, the only way is to do a C-section. Obviously, we have to go for C-sections. I've seen fistulas occurring in women who were in obstructive labor and reached the health facility too late and obviously had developed a fistula before they could reach the health facility. So really, we need to yet eradicate fistula, and the regional eradication of fistula is very, very important. So that's why I think our helping hand for training of uh, doctors, midwives, and surgeons in fistula care is very, very critical for us. Pakistan is at the forefront of fistula services, and I think the honor goes to Sher Shah. He's not here today, he was my class fellow. And he was a pioneer who brought fistula care to Pakistan. He's been, I think most of us have been wholly admirers of him because he's been through light at the end of the tunnel for every woman who was there. He's the most empathic person. He's the most, I should say, caring person who does a lot. That's what a doctor should bring to his patients. And I think the one person who is gender sensitive, extremely gender sensitive, is Shirshah. So I have to say a few words of admiration for him because he's been working tirelessly not only in Goth but also in the hinterland of Sindh, where he has camps in almost every district for training of doctors for fistula surgery, as well as we every district brings those women who are suffering from fistulas together, and he goes there and then he has his team going there and they do fistula repair, and that is why the numbers 15,000. It's not just that we go to obviously is a small center which has 200, but the overall spread throughout Sindh is also very large, and so I'm glad to say that now we are moving to Islamabad with polyclinic. So. Uh, it really, I am very, very grateful to Koohi because where we are here, we are training community midwives. Community midwives will be the front line obstetric caregivers, and they're going to be there for women in very remote villages where we don't have doctors, women doctors. We are unable to post women medical officers. So the fact that community midwives will be doing these services of obstetric care is very, very important for us, and that's how we will be. That's one step in prevention of fistulas is to give good care, and well trained community midwives is the way to go. Well trained community midwives are what we need. That's the need of the hour. And so when unfortunately what is happening in Pakistan, and I think maybe in a lot of other countries also, is the fact that gynecologists opt for C-sections. They don't want to wait for a normal delivery to occur, and they want to save time, they want to save their own hours, they want to earn more money. So in the private sector, we have a lot of C-sections coming, and C-sections with all its complications, really we need to avoid them as much as possible. Though when it is absolutely necessary, we need to have them as well. But in any case, we are also seeing, unfortunately, we are also seeing women coming with fourth, fifth pregnancy, having C-sections, having already had three C-sections, and that's unfortunate for us because and Fado program unit. Yes. That is what we want. That is what we are spreading the word of reproductive health services requires that gap between pregnancies that allows the woman to recover fully from her pregnant state and then be able to deliver a healthy baby in a normal way, not through an abnormal delivery. So thank you very much.